Hi folks, this is old Giddy up again. Today we're going to talk about President Obama's national health care proposal, a subject that's near and dear to my heart, and particularly we're going to talk about how it affects the senior citizens of our country. And in as much as I am one, I am very interested in this subject. You know, I respect a lot of people that I see and listen to on the television and radio, and Dick Morris is particularly one of my favorites. I really respect everything that he says. He has some real good information, and today's video is going to be based in part on some of his information. You know, they held a meeting here recently among the top health insurers and providers. They all met at the White House, and they all pledged to save $2 trillion over the next decade in health costs. But what they were actually doing is pledging to sabotage our medical care, our present medical care. The blunt truth, and everybody agreed to keep it quiet, is that the only way that you can reduce costs associated with medical care is to rational health care, thereby destroying our entire medical care system. Essential to any cost reduction is a cut in doctors' fees, and won't they love that? And Congress is trying to cut Medicare fees by 21%, but cuts in fees in doctors' incomes will just discourage people from entering the profession, and those that are already in the profession will cease to practice. Now in Canada, the ways that they sought to cut medical costs was to refrain from using the best drugs available to treat cancer and other life-threatening illnesses, thereby economizing at the expense of patients' lives. Now, Obama says that nobody will find changes in his or her current health insurance plans except for a magical, and I'll emphasize magical, reduction in their cost by $2,500 a year. Private health insurers will be no more private than TARP-funded banks or government-subsidized car companies. They will be controlled by government health care planners who will approve treatments, limit drug use, hold down medical incomes, and bring their cost-cutting programs to bear on the American people. Their axe will fall on the oldest and the sickest among us, those least deserving of our newly limited and, under Obama's program, diminishing health care resources. Now, the other radical changes Obama is bringing about in our nation can always be reversed. Well, we'll see. New taxes can be repealed or lowered. That which was naturalized can be privatized. Government which had grown can be cut. That'll never happen. But once the healthcare system is extended to cover everyone, and I mean everyone, with no increases in their resources, the change will be forever, and I mean forever. And you know what's even worse about the whole situation? There are millions upon millions of illegal immigrants in this country, most of which from Mexico. Each and every one of them, regardless of their age, will get medical care before I will, before my wife will, before my friends that are my age will. And this is just not right. It is not right, and I just don't know how it's going to be fixed, but we have got to do something. It's not only affected me, it's going to affect every one of you, because believe it or not, if you're less than 60 right now, you will be, mark my word, you will be a senior citizen very, very shortly. Now, folks, as I said, I respect Dick Morris, and I'm going to show you just a clip of a recent video of his, and he'll put it in perspective. And when that's finished, we'll dig into something else.
So, what Obama is proposing really is to stretch the health care more thinly over everybody. And what that means is rationing. It means no, you can't get a colonoscopy. No, you can't get bypass surgery. No, you're too old to get a hearing aid. And, you see the consequences of this in Canada, where a quarter more people than in America get colon cancer because they don't allow colonoscopies, and a quarter more of those who get cancer, colon cancer, die of it. Cancer death rates in Canada are 16% higher than in the United States, and this is all coming soon to America. Now, Obama's going to propose his health care proposals in May and June. This is going to be the crucial period. So if you want to fight this and keep your health care good, go to dickmorris.com, register with your e-address, and we will keep you posted on how to defeat this proposal, because your life may depend on it.
Mom and Dad, your grandma and your granddad may have to be sacrificed. Sacrifice. Now, what does that mean? No, it doesn't mean they're going to be tossed into the mouth of a volcano to appease the gods. And no, it won't be a ritual of some organized cult. They just simply won't be able to get medical care. They're just going to have to learn to live with pain, grin and bear it, and just step aside while the younger people, including the illegal immigrants, receive medical care. If you need a hip replacement, well, you'll just have to learn to use a wheelchair. If you need a pacemaker, that won't happen either. If you need heart surgery, that won't be forthcoming either. In other words, the older you get, excuse me, I got a little problem here. The older you get, the less care you'll receive. And that's just the way it's going to be, folks. And we have got to put a stop to Obama and his madness. I'm not sure exactly how we're going to do it, but we've all got to get our heads together. We've got to get our heads on straight. We have got to put a halt to this, and I mean quickly. So do a little research. Start reading. Look at the internet. There's gobs of information about the health care and the other atrocities being put forth by Obama. So read it, research it, and find out what's going on. Join some groups that are trying to fight these problems. Give it all you've got. This is our country, and it's going to hell in a handbasket. So let's all put all of our efforts forward to stop it dead in its tracks. Thank you, folks, and thanks for watching. And may the good Lord take a liking to you.